Hi, it's Dr. Janowski for Sonata. Today we're going to do the non-surgical nose job. It's very popular now. We're seeing almost every day someone who wants to modify their nose in some way. And of course there is the surgical nose job, which is permanent, but a lot of people are not ready to do that. It's expensive, it's a lot of recovery. So we can do a lot with filler, not everything, but a lot of things with filler. Which is super easy. It just takes a few minutes to do. You see the result right away, and it can last up to a year. So some common things we do with the nose is, if we have the dorsal hump, if we have a bump in the nose and you want it to look straight on profile, also lifting the tip, that's very easy to do with filler. Creating symmetry from left to right on the nose, these are all things that we do very easily with Restylane Lift, which is my preferred product. So what we're going to do is we're just going to inject around this little bump, and we're going to just make it straight, and we're going to lift the tip, and you'll see how easy that is. Okay, so now we're going to do the nose injection. I use a very, very small needle. People are actually surprised how little they feel. It's not a painful procedure. It doesn't take long to do. And we're going to start above the little bump here. Okay, we'll put a little ice on there, and then we're just going to put really a little product straight down in there, and we inject really onto bone here. So we want it to be safe, so there are ways to make the nose injection safe by staying on bone. And we're already seeing a nice improvement. She also has a little bit of widening from left to right of the bump, so we're going to mask that by placing some product above the bump, and always be moving our needle if we're not on bone, so that it makes it very safe. Okay, let's do a little ice right here. We kind of work our way down. It's already looking quite a bit straighter. Okay, and so what we're going to do is a little tiny poke here, and again very quickly with a very small needle. I move the needle as I'm injecting. Good. You doing okay?
Mm-hmm.
Alright. And then we'll do a little bit of icing of the tip. We do the tip very, very quickly. There's a little more sensitivity to the tip, but again, people find it quite tolerable. Okay, so we just want to make that tip a little bit higher, and so we're going to move that needle while we inject. That's the one that makes you tear a little
Yep.
bit. Everybody tears a little bit. But often that's sufficient. Relax your muscles. And we can already see a straighter nose here from left to right. And if you look at the profile, we can see that that's nice and straight there. And we just do a little bit of touch up here, but very, very little product is required. And often what we'll do is bring the patient back in about 3 weeks to touch it up with the remaining product that's left in the syringe. And we'll show you what this looks like compared to the before, but it's really just a very, very quick treatment. And you can actually mold this product. The Restylane Lift is very moldable. We can get it to take the shape that we want. Just going to do one more little one here real fast, real quick. If we do it fast, you don't feel much there. See how that tip came
Tickles.
out? Tickles, yeah.
Mm-hmm.
Okay. We're just looking for any sort of asymmetry here, and using small amounts, inject very small amounts at a time. Safer that way. Okay, let's get a wet wipe, and we'll just wipe it down and take a look. And that's kind of the whole thing. We have a pretty straight. For any little tiny adjustments here. There we go. Alright. How is that as far as pain goes?
Easy.
Easy. Okay. Well, that's all there is to it. We'll show you the results in a minute.